I did my paper on the history of anxiety disorders. And for some facts, it is the most common mental disorder. 1 in 8 children are diagnosed with general anxiety, and 1 in 3 adolescents are diagnosed. So as you can see, it's very common. Looking into the far past, we have the Greeks in around 400 BC. The Greeks believed that either an excess, surplus in bodily substances or deficiency in bodily substances and it has an association with different mood disorders. So it kind of first brought about like having different kind of mood disorders. And then Hippocrates is writing in the Corpus Hippocraticum. He was the first to describe symptoms of and label anxiety that we know today. And then melancholia also was one of the most common types back then, and it had symptoms such as anxious concerns and aimless fear. And it was also connected to depressive symptoms, so it had both the anxiety and depressive, as like it was talked about with bipolar disorder more often. And then also the Greeks, they associated anxiety with cowardliness, and they were like, big into battle and all this stuff. So that was one thing they did not want to be was, seen as anxiety, because then they were disgraced. Any of those symptoms. The Indians, they believed in the 4 noble truths, and the first noble truth was suffering is an inseparable part of life. So they believed this was rooted in anxiety, because people would get anxiety from holding on to things that can't be held on to. So that is why it was rooted in anxiety and stress. And they were also one of the first to describe symptoms of hallucination and anxiety as well. And then moving a little closer to the present is 1803, where a Scottish physician first invented the concept of neurosis as a functional disorder of the nervous system without any clearly apparent source. And then in 1871, irritable heart. This was found in soldiers of the Civil War, and they had symptoms such as palpitation, faintness, tachycardia, hyperventilation with panic. And those are obviously things you're going to find in war, but they just saw these symptoms and called it irritable heart. And as you can see, both of these are described as something physical and not psychological. And then moving into the more recent past, we have Sigmund Freud. He kind of was the main name for this era. And he had the term anxiety neurosis. And he believed it was made up of 2 things, and that was genetic predisposition and pent-up psychological pressure caused by sexual desire. And the main symptoms was anxious expectation. And he described what we now know today as panic attacks, but he called them anxiety attacks. And he had such strong opinions and everything that he was the main inspiration behind DSM-1 and DSM-2. And then another name came into play, and that was Dr. Donald Klein, when he came up with the medication imipramine. And this made patients with symptoms such as rapid breathing, palpitations, weakness, and a feeling of impending death feel significantly better. He just gave them this drug, and they had all these anxiety symptoms, and he just gave them the drug to see what happened, and then it ended up working. So then he decided that it was caused by biological malfunction and not sexual repression. So this kind of went away from what Sigmund Freud was saying. And now moving to the present, we have first the DSM-3, which came out in 1980, when it was no longer called neurosis, as what Sigmund Freud called it, but instead it was called an anxiety disorder. It will move more toward simple symptom description, and it also moved from a dimensional model, which Freud helped create, to a more categorical model, which kind of helped move into that transition where it was based on different anxiety disorder categories. And then in DSM-4, which came out in 1994, there's a distinct criteria between children and adolescents, because before that it was just lumped all together, like even children and adolescents would get the same symptoms, which we now know today is not the case. And then the DSM-5, we now have 9 different anxiety subtopics, and these include separation anxiety disorder, panic attack specifier, agoraphobia, generalized anxiety disorder, substance medication-induced anxiety, anxiety due to another med condition, unspecified anxiety disorder, and other specified anxiety disorder. So there's a big leap in that it, grew, because there was not this many anxiety disorders or this many, specified. And all of these different anxiety subtopics have one common symptom, and that is excessive fear and anxiety related behavioral disturbances. And often anxiety is co-occurring with other mental disorders. And now we have moved to a biopsychosocial model, because before they just looked at like, oh, it's just symptoms, it's biological, or then Freud came up with it as, psychological, repression, those kind of causes. But now we look at it as it's biological causes, psychological causes, and environmental and social causes, and those work together to make the diagnosis. Also, it is treated today through, it is very individualized. There might be therapy and medication that work together to come together to help a patient. And as for the future, I think there will be more specific criteria, because there have been talk about it's overly diagnosed and there's not, specific enough criteria. So one study shows that there could be precise patterns in brain networks and resting states that can determine which anxiety disorder an individual has. So they're kind of looking more biological. You can set it up, figure out exactly their resting heart rate and all that stuff to figure out exactly if they have an anxiety disorder or what kind of anxiety disorder it is. So, any questions?
So you said there were like 9 different types of anxiety. Are there different treatments for all of those?
I don't think so. I'm pretty sure it's all just like for treatments nowadays, it's more like, they work together with medication, different therapy types like cognitive behavioral therapy, and that's how they all, I'm pretty sure. That's what I got out of it. Yes, Sean?
You said that people in the Civil War, they were diagnosed with irritable heart. Do you think that would relate more to PTSD or anxiety?
In this context, I'm pretty sure they're talking about it in, like, during battles. So I think this also has to do a lot with PTSD, because obviously during battle you're going to get anxiety about it. I mean, it's scary. And then also afterwards you're going to have PTSD. So I can see where it'd be both. I think. Yeah?
Did you find anything in the far past about the causes, like anything that they might have hypothesized?
I guess I didn't really look into that as much. It was more just like, here are these crazy symptoms, it must be just something biological. I was still kind of looking at that aspect, something wrong with them.
Since you have like 9 currently, and they're going to start moving to more specific criteria, and since it's so overly diagnosed, do you think they're going to try and trend down that category to have fewer anxiety disorders, or do you think it's going to expand even more?
I don't think it would expand anymore, just because, I mean, I don't know. It seems, yeah, it seems to be where it should be maybe, but just more specified, more figuring out exactly what they have, so it's not like everyone's, oh, you have these symptoms. I don't know. That's how I can picture it kind of fitting. Yeah.
Since children and adolescents are defined different under anxiety than adults, do they still fall into the same 9 categories, or do they have different criteria that they have to meet?
I was looking at it a few days ago, the actual DSM, and it would be for adults, it would be these symptoms have to occur for maybe 4 months or something like that, while children, if it's in them for 4 weeks. So it's different, specified like that, or they might have different symptoms. The adults would be this, and then the children would be it might look different, their symptoms. So that's how they're different. Okay.